Most people may experience anal discomfort at some point in their lives, but they don't talk about it because it's quite an embarrassing topic to discuss. The most common complaints involve pain and itching, and in some cases may even involve bleeding.
Anal diseases are any abnormalities sa anus, and the most common anal diseases are hemorrhoids, anal fissure, which is a wound in the anus, and then fistulas, or yung pigsa na pumutok na hindi gumagaling.
The risk increases, especially if you have a poor diet and hygiene. Too much moisture in your bottom can also lead to itching. But while these anal ailments may temporarily cause discomfort and soreness, there are many ways to alleviate the situation.
One of the main messages is, even if these are common conditions, these are not life-threatening conditions, best to have it checked up just to make sure, especially if you're at the age 40 or 50, or if you have changes in the way you move your bowels.
What types of foods should you eat to avoid anal discomfort? What treatment options are available for this kind of medical condition? All these and more tonight on MedTalk.
Joining us tonight is Dr. Armando Crisostomo, a colorectal surgeon at the QualiMed Health Network. He's also a former president of the Philippine College of Surgeons. Also joining us tonight is Dr. Manuel Francisco Rojas, Consultant Director of the Medical City Colorectal Clinic and the Chairman of the Department of Surgery of the Medical City. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome
Good evening,
to MedTalk.
Good evening, Angel.
Doc Rami and Doc Arman.
Yes.
So as colorectal surgeons, you tackle the medical concerns of the rectum and the anus. So tonight it's about anal diseases. What are anal diseases? Doc Rami, let's start with you.
Well, there are many diseases that actually can affect the anus. So we call them anal diseases because they affect those areas there. And there are several very common ones. For instance, hemorrhoids, and then fissures, and abscesses and fistulas, as well as anal warts. No? But other than that, there are other conditions that should be brought to the attention of a doctor also. So there are many conditions actually. So we love them all as one when we discuss this in a topic like this, in a forum like this.
So before we go into the diseases of the anus and the rectum, let's first understand the function of the rectum and the anus. Doc Arman, please tell us about that.
Yes, well, the rectum or the anus is considered the terminal portion of the gastrointestinal tract. It is part of the excretory system. So any excess food or waste materials that our body ingests and no longer needs is expelled through that very important part of the anatomy called the anus and rectum. And here, usually, as we become adults, the stools, which form part of the waste material, become somewhat solid in character. And in children or in babies, we have not developed that ability to voluntarily expel the contents of the rectum. But as we get older, we develop that capability to be able to detect whether we are going to pass out gas or whether we're going to pass out something very soft, or we have some diarrhea, or whether what is going to come out is solid. So at an appropriate time, our anus and rectum is a very sensitive organ in itself, because it's able to distinguish whether you're going to pass gas, liquid, or stool, solid stool, at an appropriate time. So it gives you these signals which are processed by your brain, so that at an appropriate time you go to the comfort room to expel yourself. You know? So just imagine, you know, if you put in a mixture of air, water, and solid in your hand, can your hand, you know, be able to expel air only, liquid only? Your hand cannot do that. But they say your anus and rectum can do that. So that's how important